Even if there is some asymptomatic transmission, in all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of outbreaks. The driver of outbreaks is always a symptomatic person. Even if there's a rare asymptomatic person that might transmit, an epidemic is not driven by asymptomatic carriers.
Recent research, however, conflicts on just how much people with no symptoms actually do spread the virus. This recent study in JAMA says asymptomatic people account for more than half of all COVID-19 cases, but it's based on what's called a modeling study.
Which means they use mathematical predictions to determine reality. It's not an actual true measurement of reality.
Dr. Chad Savage, a healthcare policy advisor for the Heartland Institute, says that doesn't mean it's not valid. But by contrast, if you look at this recent study in the journal Nature, it is a true measurement of reality.
They followed 300 asymptomatic patients and they contact traced them. They looked at about 1,200 close contacts to them to see if asymptomatic spread occurred.
Both studies do use data from China, which Dr. Savage points out may or may not be similar to the United States.
So where do we go from here then? Is it masks forever?
That's the million-dollar question. We do have pretty good data that people who are sick wearing masks decrease transmission to other people. The assumption that everyone needs to wear a mask is based on the thought that, well, you don't know you're sick, you don't know you're contagious, you are spreading it, and therefore you are a sick person, you just don't know it yet, so you need to wear a mask. But if that proves not to be true, then that entire policy is for naught.